Hello, we're delighted to present our poster, Promise for Success, a trauma-informed and trauma-responsive community intervention. Promise is a multi-tiered implementation science approach with two arms, namely school and community. I will provide a brief overview of the school arm. As background, we sought to address the wicked problem of toxic traumatic stress at a local middle school in Ypsilanti, Michigan, that is resourced in some ways and under-resourced in other ways. Research informs us that adverse childhood experiences and environments, ACEs, such as abuse, community violence, food insecurity, and racism, can get under the skin, impacting youth's academic performance and place them at elevated risk for a host of mental and physical health problems. For these reasons, Promise sought to focus on the 4 R's of a trauma-informed approach. Realize the widespread impacts of trauma, recognize the warning signs of toxic traumatic stress, respond with trauma-informed practices, and resist re-traumatization. We do this via the implementation of trauma-informed positive behavioral interventions and supports, or PBIS, for students school-wide. Compassion resilience circles for teachers as well as for parents. And for teachers, these circles are designed to build compassionate relationships, recognize and prevent compassion fatigue, and promote self-care. To evaluate our programs, we will administer surveys and track PBIS. Based on recent evaluations, we know that over 80% of teachers were extremely to somewhat satisfied with our trauma-informed PBIS training, as well as with our more in-depth trauma-informed PBIS classroom practices. In terms of next steps, we will continue to implement and evaluate our school-based interventions in this final year 3. And now here is my colleague, Brenda Averett, who will share a bit more.
Thank you, Polly. Promise has been instrumental in providing trauma-informed education for our students and our teachers. Implementing a support group for parents is essential. Recognizing parents make the difference. Parents have the opportunity to participate in a 6-week virtual support group to prevent compassion fatigue. Building resilience, we know parents are the core for change, for our students, for our families, and for our community. Building a community of resilience, Promise have implemented a 3-tier approach. Our tier 1 focus on our students, tier 2 is focusing on our parents, and Jesse Marshall will focus on the community arm, tier 3.
Thank you, Brenda. So the overarching goal of the community arm is to support the middle school's community partners in establishing a trauma-informed and responsive organizational system. The activities entail having had identified key community partners, which was done by the middle school, and the offerings of a 2-hour interactive training session that had initially been done in person, but now are remote. These sessions include information about local socioeconomic and health equity data produced by the County Health Department, in addition to applications of the ACEs framework for trauma-informed and responsive integration into an organization's policies, procedures, and protocols. Also, information has been provided on strategies of accessing community and healthcare resources and promoting and cultivating resilience for families, children, community, and self. And all of these trainings are based off of teachings from the Michigan ACE Initiative and the American Academy of Pediatrics Resilience Project. For evaluation, we've adapted surveys from the Michigan ACE Initiative for pre and post-training surveys. And then also we added a question regarding COVID-19's impact on work function and organization. And lastly, we have been doing follow-up key informant interviews of participating organization heads regarding their progress and need for technical support. Some early themes from these interviews have included that there needs to be more information on practical interventions, and COVID-19 has forced providers and servicers to be more creative in meeting the needs. Next steps includes completing these training sessions and following up further with key informant interviews. Thank you.